Hi, everyone. Thanks for joining us today for a Wake Up with Wasatch webinar. Today, we have our clinical director, Rich McDonald, and our program director, Jessica Keddington, to talk about how women recover and the advantages of gender-specific transitional living. So they're going to go over the differences between how women and men face addiction and recovery differently. If you have any questions at any time, you can use your control panel to ask them. And there's a handout in the handout section of the control panel with collateral pieces that overview Wasatch Crest and what our services are. So I will hand it over to Rich and Jessica to start the presentation.
Perfect. Thank you, Kayla. Thanks, everybody, for joining us this morning. I'm glad to have Jessica here. Obviously, as a man, I can speak from one perspective and the things that I've noticed as a clinician and also as a person in recovery. But I think it was important to have another perspective as well. So again, thanks for joining us. One of the things that kind of prompted this topic in particular was that we just got our women's sober living house up, open, and we've got several women over there right now that are doing really well and being able to take advantage of that. We also have our men's sober living, which has been open for quite a while. So it was a really, needed addition to what we do here at Wasatch Crest, and it's a big, makes a big difference when we can offer that level of care. So let's just start. Maybe Jessica, do you want to just introduce yourself a little bit and yeah.
Yeah, hi, good morning, everyone. Excited to be here with Rich this morning. And, I am not a clinician, but I do have my own personal experience being a woman in long-term recovery and kind of seeing how, that's differed and played out. And so I'm excited to join and be on the webinar this morning.
Awesome, thanks. So I think maybe the first place to start is, I think one of the things historically that's happened is there's kind of this one size fits all. Everybody in the industry will talk about, individualized treatment planning, and I believe that happens in many, many treatment centers. But overall, are we really taking a second to look at, gender-specific treatment and being able to, integrate that into programming? And when we do have a co-ed facility, like our residential program is a co-ed program, how can we really take the opportunity to separate out some of that treatment and offer the best possible care for our clients? And there's also the other component of the LGBTQ community. We work with many different populations, and being able to help understand and engage those folks makes a big difference. One of the things that I know from my point of view and from my own recovery is that we spend, at least in my experience, one of the struggles we have with men in particular is being able to get them to be vulnerable. Their whole lives, they're told many times, I don't want to be too general, oftentimes they're told don't cry, suck it up, all of that, really oftentimes toxic masculinity is put on them, and then suddenly they're in recovery and we say be vulnerable and be open. And so, from that point of view, sometimes that's not necessarily what we're needing to focus on with women. A lot of times, being able to provide a safe space is the first place to start, I think, with women. Oftentimes, unfortunately, it's a lot easier for men to step away. Again, I'm trying to be careful not to generalize, but I've noticed through my own, anecdotal experience, oftentimes the clients we care for, the women we take care of, may have children at home. It seems to be a fundamental concern often if they've got children at home, and how do we get them into treatment, get them sober so they can get back to their families. It's important to do that for men as well. But then also looking at, significant trauma. It's a huge part of what we see in women struggling from addiction. As far as specific needs go, do you have anything to add to that, Jessica?
No, I think that, there's different needs too. I think, women are, we're told if we have children at home or we work, like we have to take care of everything. And I think, like you were saying, walking away from that and kind of leaving it can be difficult. And so just giving women a safe space in treatment to focus on themselves for kind of sometimes the first time in a while lets them really begin that recovery process. So.
No, absolutely. And being able to like I think one of the things that I've noticed is, we often, my experience with treatment was that I had a 10-day, no contact blackout period. I couldn't communicate with my kids. They didn't know where I was. They were really little. Luckily, they were at home with their mom. But I think that that's kind of evolved over the years, hopefully. And if we can help support both men and women, I guess, with staying connected with their family while they're with us and starting to do some of that work, and then helping support them to really stay engaged. And it's hard to focus on yourself in treatment when you're worried about outside issues. But I think that brings up an entirely, separate thing. What are we doing to support women and families, and how can we help make that experience here the best experience possible, whether it's, helping them with COVID, especially recently. It's been harder to have in-person visits. We haven't done that for probably about a year. We're getting ready to start doing that with some significant restrictions, but really like making sure that, they know that everything's taken care of at home so they can focus on what they're doing here. But I think, really that residential component of getting people stabilized and kind of pointed in the right direction, it's really a lot of the real work begins once they step into the sober living environment, which is where we can really help them start to experience what it's like, living life in sobriety. And I think just in general, the sober living thing is a huge part of a healthy recovery. It gives them a chance to slowly re-engage and get back on track. So, honestly, for both men and women, that piece is huge. Like, you can't come to residential treatment for 30 days, step right back into your old life and scenario and environment, and expect to be successful very easily. Now, one of the things that I think is really important for that experience too is having gender specific sober livings or transitional living. It gives us an opportunity really to be vulnerable with people. Sometimes that doesn't come easily, and we see it all the time with spend a lot of time in residential treatment working with the men and women to not pair off and not become romantically involved, and being able to have a safe space where it's gender specific and that's not our primary concern. It takes one of the big things off the table, and it kind of forces us to look at ourselves a little bit harder, and then maybe become friends with people that we may not have become friends with outside of treatment. I think that's a learning, growing, huge part of recovery, is that connection with other people that you may not normally connect with.
I agree completely. When I first came into, when I first got sober and started my recovery journey, like being friends with other women was the most terrifying thing. I think being in a gender specific transitional living and sober living is what kind of started that. I could focus on those relationships instead of the relationships with men. And I think that it really helped with a lot of that shame and trauma that we come into recovery with, where I could start focusing on that and healing that instead of focusing on the opposite gender and how I looked and how we acted and, you know, keeping those guards up. And I think that all of that healing really starts once you start building those relationships with other people of the same gender that have similar experiences as you.
Absolutely. No, that's awesome. I think that validation from people that, or from those around you that you're connecting with, that is not in any way sexualized, or there's not that underlying component there, makes a big difference too. Like, wow, you know, they validate me for me and want to be around me for me, versus, you know, all the other complicated things that happen with treatment. That's awesome. So maybe we talk a little bit about, I can get the slide to change there, guys. There we go. Okay. I thought I'd maybe just talk briefly about how our Uinta women's sober living is set up. And so, you know, sometimes I forget to explain. So Wasatch Crest is located in Heber, Utah. It's about 10 minutes outside of Park City. And the name comes from the Wasatch Mountain Range. Salt Lake City's on one side, Heber's on the other side. And when we were opening the two sober living houses, we kept calling it, I can't remember what we kept calling it, but we didn't have a name for it. And the backdrop for at Wasatch Crest and opposite the Wasatch Mountains is the Uinta mountain range. And it's about, you know, you can, I guess, technically be in the Uintas in about 3 minutes. And so that's how we chose the name. And it's funny, I'll talk to somebody on the phone that's not from Utah. I mean, everything in Utah is named Wasatch. They're like, there's schools and, I mean, any kind of business you can think of. It's a very common name, but you try to say that to somebody outside of Utah, and it's always kind of fun watching them pronounce it. So our sober living, our men's house and our women's house are the Uinta house. The way we've got it set up right now is most of our clients come into Wasatch Crest. They'll do anywhere from, you know, 3 to 8 weeks in residential treatment. You know, most of the time, by the time we get them stabilized and work through a level system and get them stabilized and ready to transition, they're here for about 30 to 45 days, but that's not always the case. Sometimes we move them along a little bit faster, depending on the circumstance. And then when they do transition to our sober living, the first little while, in general, they'll do day treatment, which is Monday through Friday, about 5.5, 6 hours a day, you know, 5 days a week. And during the week, we'll do 3 of the days they don't come over to Wasatch, or they don't come over to programming until lunchtime. So they've got that morning where they can start working on, you know, life skills stuff, case management stuff, you know, getting their resumes done, looking for work, anything that they need to do to help make them or set them up for success when they leave the treatment environment. And then the other days they come over in the morning, so they have the evenings to attend meetings, and we keep them really busy. And one of the big parts of what they do really is that life skills, case management piece that happens at the Uinta houses. So each house has their own designated kind of lead. If you guys have been on any of our webinars or Facebook Lives, Becky Wheelock is the women's house lead. And for the most part, they have supervision for a good part of every day. And Becky does an excellent job of supporting them and making sure that they're making progress, communicating with the treatment team on what's going on with their client, with those folks that are over at the house, and helping support them. Currently, we include all of the meals at Uinta, and we help transport them. So we get them over to programming, but also if they've got a job or they're starting to work a little bit, we can help get them there, help support them getting to those things. And you know, on the weekends, once they've stabilized in the new environment at Uinta, we'll get them to their families and 24-hour pass or whatever that looks like. But it's still highly structured. One of our challenges is, you know, being in Heber, it's a pretty small town, and there's no public transportation. So it was important to us when we set it up that we could help support those clients. A lot of them may not have cars or, you know, the ability to get to and from places up here, and it's pretty spread out. So, you know, a bike may work for a few spots, but overall, they need that support so they can get their life back on track. Jessica, is there anything you can think of that you've seen with the Women's House or anything you want to add?
Well, I think just maybe to add to that is earlier you had talked about that individualized treatment piece. And I think once they get to transitional living, this is the time that we can really help each individual client with life skills and what they specifically need. So is that resume building? Is that budgeting? Do they need to learn how to grocery shop? Like, this is the time that we can really focus on what, you know, where each of them are at in life and kind of what areas they're struggling with. Which I think is so important that we kind of, as we start stepping them down to a less restrictive environment, they're learning these things so that when they go home, it doesn't become too overwhelming.
Oh, absolutely. I'm really glad you said that. It's been interesting. When I got sober, I think I was 32, and I'd had a career and I had 4 kids, and I was married and owned a house. And the piece that I didn't see until, you know, however long I've been working in treatment, I guess, what, 8 or 9 years, I saw something that I didn't really expect. And it was like somebody would show up to go to a court appointment, and they'd be in their basketball shorts and a t-shirt, or, you know, they'd be going to a job interview with a t-shirt on. And just that basic, like, functioning and just the experiences that they've missed out on along the way, being able to support them is incredible. Like, the budgeting thing's huge. I walked in to check on the house the other day with one of our other employees, and they were reviewing the grocery list. So, and going through that with their housemates, you know, they have the budget, and it was an interesting conversation to walk into, but just really, like, understanding that day-to-day life skills that helps us be successful. You know, if you're
and I was laughing a little bit when you were saying that, because I am the opposite. I got sober when I was 20 and had no experience. I'd never held a job long term. I'd never, you know, really lived on my own or paid a single bill or any of that. And so when I came in, I was like, what? Like, you have to pay your car insurance every month? Like, I don't understand how any of this works. And so that life skills piece for me, just learning how to be a functioning adult, was huge.
Yeah, absolutely. And I think, you know, it's been nice to see, I think in the current, you know, treatment environment, like, it really has given us a piece where we can give them that much longer before they have to jump back into real life, and they can start rebuilding everything. So I think that is about it. Does anybody have any questions about Uinta or anything that Jessica or I could answer?
I'm not seeing any questions, so I'll go ahead and preview our next webinar. It's going to be on July 30th. It's a Friday at 9 a.m. Mountain Time. And our clinical team is going to be talking about equine therapy at Wasatch Crest.
Awesome. And I think we'll have Adeline there, kind of going over that, Kayla.
Okay, great. Yeah, Adeline is our director of recreational therapy. So it'll be a good webinar, and look out for registration links in your email. And then there's our admissions phone number and our website, wasatchcresttreatment.com. Our admissions phone number is 24/7, so feel free to share it out. And like I said, there's handouts in the handout section of this, so you can download that and learn more about us. And that's all I have. Thank you so much, Rich and Jessica.
Thank you.
Thank you.
Bye.